Hello, everyone. So, detoxification is the topic for our session today. And to talk about this particular topic, we have Dr. Bindiya Gandhi. She is MD, board certified functional medicine doctor based in US. Welcome, Dr. Gandhi.
Thank you so much for having me today.
Great. So let's understand this detoxification. You go on Google and it's so many conflicting ideas and talks people are talking about. We wanted to hear from the MD perspective, what exactly is detoxification?
Great question. So technically we're detoxing the whole time. Every single day that we're waking up, our cells are regenerating and renewing. And so we're detoxing every single day. But when we're talking about detoxing, there's 5 base things that we kind of need to pay attention to, right? And those are the organs that help kind of clear toxins out of our body. So the liver is a big one, right? The kidneys, our GI tract, our skin, because that's where our pores are and that's where we sweat, our lungs, because we're breathing. And then I even include a 6th one, and that's the heart, because there's an emotional component to detoxing as well. So that's just in a nutshell how we, every single day are detoxing and getting rid of toxins and impurities of our body.
Sure. So, but when we talk about, hey, I need to get a detox done, right? That's become so fashionable.
Yeah.
Right. So what does that mean?
Yeah. So, detoxing can technically also be a fad, right? And there's people also think of quick fixes. And that's where people get detoxing wrong, actually. So when you're talking about detoxing, I'm talking about medical detoxes, right? People will fast, do a 24-hour fast, and they're like, oh, I did a detox. Or people will, go on a juice cleanse for a whole week, and they're like, oh, I did a detox. Or they'll do colonics, or, read something on the net, whatever, right? Those don't always give you the same results as a medical detox, right? So when I'm talking about medical detoxes, I'm talking about phase 1 detoxing and phase 2 detoxing in your liver. That happens in your liver. And phase 3 detoxing that happens in your gut, right? So these are long-term effects about, what's really going on. So even though there are tons of fads out there, it's not necessarily the best thing. And there's hormonal detoxes. There's so many different types of detoxing depending on, what's going on with your body, your symptoms, your hormones. If we're trying to decrease inflammation, if we're trying to prevent cancers or reverse some of these things, everything goes into play. I look at genetics. Genetics are really a big, important proponent when it comes to detoxing because, Amita, the way you detox is going to be completely different than the way I detox genetically. And there's so many things that we're exposed to, like toxins in the air, the foods that we're eating, the chemicals that we're constantly exposed to that we're, washing our hands with every day. So all these factors really contribute to how our bodies are really functioning optimally. And to make sure we're doing a good job, we need to make sure that we're also tuning in and tweaking our detoxification process so that we are, so it's benefiting us in the long run.
Sure. So what would be the signs, like what kind of symptoms would someone feel that they need to get a detox done?
It can range from, I'm just exhausted. I'm just tired. I have a headache all the time. It could be the fact that you're constipated. You're not pooping regularly all the time. Maybe you go to the bathroom once or twice a week. It could be the fact that you're dehydrated, or it could be the fact that even more so that you're retaining a lot of fluid, the opposite, which you're retaining a lot of fluid. And it could just also be that you're just not feeling your best, not just energy wise, but you're just your mood is off. So there's so many different reasons. You may be bloated. There's, so many different signs and symptoms. Some people don't really pay attention to some of those symptoms as, oh my goodness, does that mean I have to detox? If I have a headache, does that mean my detoxification system is off? If I am, having more swelling in my feet, does that mean my detoxification system is off? We have a lymphatic system that we also detoxify from.
Sure. So, and tell us the difference between a cleanse and a detox.
Yeah. So cleanses, I think, are like a quick fix, right? So if we're talking about it's like a cayenne pepper, maple syrup, lemon juice, water cleanse, that's like a quick fix, something that you're just maybe, yes, you're eliminating some toxins from your body, but it's not necessarily hitting phase 1, phase 2, and phase 3 detox like we should from a medical perspective, right? So those are quick fixes. They give you short-term results. They don't give you the long-term results that I'm looking for or how I treat my patients from a medical perspective.
So tell us a little bit about how do you do it, the medical detox part?
Yeah. So, every patient is different. The detox I may put you on may be different from another patient I'm putting it on. It's very individualized, right? Again, like I said, I'm looking at genetics. I'm a big data girl, so I'm looking at a lot of testing, right? So I look at a lot of lab testing and then and put specific protocols based on that. So if I find out, Amita, that your hormones are off, I'm just going to throw this out there. Maybe you have you're estrogen dominant. I'm going to want to do an estrogen detox on you, right? To kind of help balance your hormones from that perspective. If we're talking about someone else who is maybe constipated, has a lot of GI issues, has a lot of autoimmune issues, I'm going to put them on a different type of detox, right? But ultimately, the goal for all of you guys that are on the detox is we're triggering we're basically eliminating toxins from your body, and it's a very comprehensive approach. So I'm going to be changing up your diet. Your diet's going to be different from someone else's. I'm going to be including supplements. I may consider a shake or two to kind of help support your nutrition, because when we're eliminating certain things, we also need to replenish the body. I sometimes will use IV therapy to also help with detoxing too. So, it's a very specific, individualized approach, but it also depends on what we're trying to accomplish.
So the step number one would be you'll do the testing to understand what's happening in the body before you recommend.
Yes. Yeah, I'm a big lab girl. I'm a big data girl. I like to track it. I like to see where you are today, where you're going to be 6 months. Because if I'm talking about decreasing your inflammatory markers, I want to trend that, and I want to show you, my patient, that we're heading in the right direction.
Sure. So, what are your views on Ayurveda Panchakarma, which is also supposed to be a detox?
Yeah, so I think that works for some people. I don't think it works for everybody. Ayurvedic methods really do help a lot of people. The nuance, I was just kind of explaining this the other day, is the nuance with Ayurveda is, it doesn't take into consideration, nutritional deficiencies. It doesn't take into consideration genetics. It doesn't take into consideration like blood types, and not just that, but it doesn't take into consideration if you've got food sensitivities or food allergies. So some of those things really work well for, I think, a generalized healthy person with no food allergies, no food sensitivities, no nutritional deficiencies, right? I think it may work really well for some people, but there are some people, for example, it may be too strenuous on their body, right? If we're talking, I'm just going to throw this out there. If we're talking about someone that has like cancer, precancerous, and we're having them do panchakarma, it may not be good for them at that time, right? Does that make sense? So it's very individualized. I think it has its place, and I think for some people it works extremely well.
So it depends on, like, people who are healthy, they're getting a panchakarma done.
Yeah.
Therapy, that's okay. But if someone has a little
sicker,
then the diet, the blood test and all the minute details that someone has to go through, that could be a little bit of
Yeah, for sure.
So let's just talk about foods, right? Simple foods that we can eat on a daily basis to help detox our body.
Yeah. So, again, food is the first place I start with a lot of my patients. Just drinking water, you're kind of flushing out your kidneys. That's like the first thing, but tweaking it, adding a little bit lemon in your water, making sure you're drinking a little bit warm water. That's kind of an Ayurvedic, technique that many people are used to. So just tweaking things like that, you're already getting your body detoxifying. Drinking green tea is also better for detoxifying than, say, coffee, or even traditional black tea or cha, right? Because green tea has a lot more polyphenols, antioxidants, and that's really supporting your detoxification system. Making sure you're pooping, so making sure you're eating a lot of fiber. Again, that's helping your detoxification system. The more you poop, the better, right? And then stuff that really supports detoxification: broccoli, lots of greens, broccoli, chard, cauliflower, collards, Brussels sprouts, cruciferous vegetables, kale, spinach. That's all really squeezing out all the toxins, because it's got sulforaphane in it. That's really squeezing out the toxins in your liver, and that goes through phase 1 and phase 2 detox. So, there's so many things that we eat and we're exposed to every single day that really can be beneficial for us without going on a strict diet or without doing anything, crazy. And you guys know this, khichdi, going on like a little khichdi fast can sometimes also be very detoxifying, because what that's really doing is adding fiber to your gut. And that's really, really important for, ensuring that your GI tract is being supported, and also start helping eliminate enforcing the elimination process.
Sure, sure. And the khichdi diet, sometimes they say 8 days, 10 days, or 1 month, which 1 month I can't even imagine being on a khichdi diet. It's, but maybe it's okay for a gentle cleanse. And like
for like a 24-hour, 48 cleanse, and someone that's not diabetes, that doesn't have insulin resistance, I think is perfect. But of course, if we're talking about you eating khichdi for like 30 days, you know, it can cause a lot of problems for some people. I mean, yes, it's helpful, but you know, again, this is where, you know, I'm going to make recommendations based on, okay, I know you're A1C, you're not pre-diabetic. You can eat khichdi for 7 days and completely be fine.
Yeah, yeah. Well, this is very informational. Anything else you'd like to add, Dr. Bindiya?
No, I mean, you know, there's a lot I think we covered. So no, I think we're good.
Okay, well, thank you so much. We are going to be telecasting this live. If you have any questions, comments, you are welcome to put it on Facebook. And then we will be putting this interview on Insta as well at a later point. Thank you so much, Dr. Bindiya, for being with us. And thank you, everyone, for supporting us.